Good day, friends of Buzzy. Today on our COVID Facebook Live, I'm going to do three things. I'm going to talk about the new nose news, because you know I love talking about the nose. I am going to do a quiz on coronavirus things that we've learned. There are a lot of people that are upset that the early things that Dr. Fauci said are now changed to something else. The reality is that's what science is, and so when we learn something new, when we come up with something new, we replace it if it's better than the old thing we had. So I'm going to do a little bit of a quiz so that you can, first of all, guess what the right answer is on safety and on what we know about coronavirus, but also emphasize the fact that things that we thought were true at one point, now we know are not, and we need to act on the new knowledge, not the old, slow, incorrect assumptions. That is going to lead on to my school plan. So everybody is asking me questions about school, what's safe, what's not. I don't think anybody actually listens to me enough to make use of the plans that I make. But if I were running the world, I will tell you what I would do to keep us all safe from school and to allow us to be able to mingle, have football games, do the kind of things that give life meaning and make us happy. Here we go. All right, so here's my new nose news. As you probably know, that since March, I have been of the opinion that coronavirus primarily enters through the nose. This is because of the size of the nose in people who get it badly. Children have tiny noses, don't get it. Old men in particular, honking noses, but more importantly, big honking nasal cavities like that. This was supported by a paper in Nature in April, a paper in Cell at the end of May, both of which found that the ACE2 receptors and the TMPRSS2 genes are expressed primarily in the nose. So people are getting this in the nose. So my new nose news is there is a vaccine which has been tried and found effective at University of Alabama that's nasal. No injections, purely a squirting up the nose. And what's more important is that in 14 days, they were able to see an IgG immune response. So there's a couple different kind of immunoglobulins, and it's too complicated for now, but it matters a lot because these are the antibodies that we're talking about that don't stick around for very long, and these are the antibodies that you need to have to rapidly attack the coronavirus. The cool thing is that the antibodies that line your gut and line your nose are IgA. We haven't talked about those very much because most people are looking at IgG and IgM when they're talking about antibodies sticking around. The awesome thing was that this nasal vaccine stimulated IgA, but within 2 weeks, IgG was already hugely high and circulating. So that's great, right? How come nobody's talking about it? Well, because it was in mice, and so they've got the mice one, and then they're going to have to go to the human phase 1, and then possibly a phase 2, phase 3 combination thing. So we're still talking about a long time before we get it. But this is really important. I have learned in the last 2 weeks from some people who are doing work with the vaccines that there may be good immune responses, but the side effects on some of them are pretty bad, and on some of them may actually be more dangerous if you catch the virus a second time. I do think that a nasal vaccine, which has been done before for flu with varying effect, but flu actually does come in a lot on your hands, in your mouth, and your eyes. The beautiful thing about coronavirus and a nasal vaccine is that it's coming in through the nose. So if you're protecting your nose and make it unable to have the coronavirus spikes hook onto the ACE2 receptors, you're pretty much done. So that's really exciting. Only perhaps slightly less exciting is the fact that thanks to Navage and Neilmed Pharmaceuticals, we are going to be able to do our nasal irrigation trial. So the protocol is going to look at nasal irrigation in people who test positive for coronavirus, It will be looking at either alkalinizing the nose of half of them, so using nasal irrigation with a little bit of baking soda, or using a virucidal to kill the virus. So that's betadine. So we'll have betadine versus baking soda. Both groups will do the nasal irrigation, and we'll just see, based on how many times they do nasal irrigation, what of these three different things correlates with severity of illness. This is in people who test positive. We do have a place to do this where we're getting results in a day. So it's almost meant to be. In Atlanta, it's taking us between 7 and 10 days to get results. So finding a place with huge numbers of cases where we can make a really big difference and find out if someone is positive in a day, that's a big deal. All right, so I've talked enough about noses. Now you've had a couple hints. So let's talk about the differences between what we thought initially and what we think now. So here's a little quiz. Which is more accurate, the World Health Organization or medRxiv? So medRxiv, which is spelled medRxiv, those are the preprints. Those are the early, before the science is actually published, while it's waiting to be peer-reviewed. Those are those articles. And then you have the World Health Organization. So, bit of an opinion here, but which one of these is more accurate? Guess? Bing, 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 bing. So it turns out that for coronavirus, things are moving so quickly that the direction that's accurate has more often been in medRxiv than it has been with World Health Organization. Case in point, don't wear masks. This is something that now has been disproven. It's widely out there, and I think what's going on is that the World Health Organization doesn't want to be wrong. They're not used to a fast-moving pandemic. So the things that the World Health Organization puts out are initial impressions and things that they're absolutely 100% rock sure on. I think what we need is a subset of likely directions so that when healthcare workers are looking at the way that coronavirus is progressing, that people can have a general direction rather than an absolute right or wrong. Organizations like the CDC, the World Health Organization, are used to putting out only 100% positive, low-risk statements. They don't want to put something out that could be misconstrued because of exactly what we have going on now. We've got confusion and people getting angry because someone initially said masks are only for healthcare workers, and now they're saying everybody needs masks. I think that what this underscores is that in our mechanism for dealing with pandemics and in dealing with medicine in general, we need to have work in progress concept. And it'd be better if we had some sort of a relative valuation, but right now in coronavirus, the actual impact of medRxiv has had more help in saving lives than the specific impact of World Health Organization because they are built and designed for a different thing. They're designed for lasting years at a time health advice, and we're in minute to minute. All right, the rest of them are going to be a little bit more fun. So now for opening schools. Which of these things is more important? This is a blinky thing thermometer. Low. This is a blinky thing thermometer. Not touching. I am 98.8. And then we got two great tastes that go great together, coffee and peanut butter. All right, which one is more important to open schools? Lay your money down. Oh yeah, the up is like, up is not as good. I think down is good. That's what I've decided. So down is good. Yeah, so it turns out that people who have fevers are 2.6 times more likely to have coronavirus. People who cannot smell are, I forget the number, but basically 81% of people with coronavirus can't smell, and only about 30% of people with coronavirus have fevers. So if we really want to do a screening before everybody goes to class, we ought to be doing a scratch and sniff. We ought to have them shut their eyes and say, all right, what are you smelling now? And if they can't tell you that this is coffee, then those are the people who need to go someplace aside from mixing around in the classroom. All right, now let's do an easy one. All right, which is more important in preventing the spread of coronavirus? We got this or this. All right, are you guessing? Turns out that all of the cleaning we were doing of groceries and the hand washing exhortations and all of that, that this is not a disease that is spread by fomites. So fomites are little particles of a virus that sit on things. The initial idea was, yeah, it's a respiratory virus, but the respiratory virus is going to go like this, and it's going to live forever on surfaces, and you're going to touch it with your hands, and then, God forbid, you're going to stick your eye, or you're going to eat with your hands, and then that's how you're going to get it. Turns out, there are almost no active ACE2 receptors in the mouth that are coupled with active TMPRSS2 genes, and you got to have both of them to get the virus in. So the mask is way more important, not only in not catching it yourself, but also in, of course, not spreading it to other people. So mask versus hand washer, mask for the win in preventing. All right, let's keep on this theme. How about N95 mask versus cloth double thickness mask that you make yourself? All right, N95, cloth double thickness. This one's kind of a trick question, because think that in this one, the issue with the mask is what you're trying to achieve. If you're trying not to catch it yourself, then in theory, an N95 is going to protect you from particles coming in more. If you're not going to spread it, it's probably the same. The thing is, when you're wearing an N95, if you're not used to it, you tend to want to take it off. It's obnoxious. And cloth masks may be more comfortable, particularly if they're made of double thickness antimicrobial sheets, pillowcases, or poly cotton blend, again, double thickness. So this one I'm going to go for toss up, but the important thing is that you wear a mask. So let's do this. All right. Which is more important? If you're going to do it, let's see. I mean, walking into things is bad. All right. So for preventing coronavirus, would you rather have somebody walking around like this or somebody walking around like this? All right, by now I think you've got the idea. It's actually more important to cover up your nose. Yeah, you can spread it from your mouth. You can spread from talking. So let me rephrase this. What's more important from catching the disease is you really want to keep sure your nose is covered. From spreading it, it's probably more of a mouth thing, because talking, yelling, singing, those things spread coronavirus. If you have it on and you're around people and you're yelling and singing, we haven't seen a lot of increase in cases. But if you don't have a mask on, that's when people are getting it, particularly indoors. All right, so for my last one, I want you to imagine a beautiful beach scene with lots of people on the beach, like we've seen in every single article that's just talking about how these people are not hunkering down, and then a picture of 4 people in a room together without masks on. So also interesting by now, early on, if these 4 people were distancing from each other, and if they had hand sanitizer, and if they were not touching each other or eating after each other, we probably would have said that the social distancing was the really important part. What we've learned is that what really makes a difference is the air movement. So because there are a lot of respiratory droplets that are tiny, small, so those are the aerosols, are really just anything in air. So whether it's a respiratory droplet or a micro droplet, that getting breathed in through the nose is how you're catching it. And so because of that, if you're outside on the beach, especially if it's windy, it's extremely unlikely, even without a mask or distancing, that you're going to catch coronavirus, because the wind is diluting the incredible amount of viral load that you need to get. But staying in a closed room for even an hour with unmasked people and either recycled air conditioning or no air conditioning, the risk of getting it is about 16%. So that will move me on to my third point. This is Baxter's plan for reopening school. Okay, couple things. One is that there really is a difference for risk with elementary school, middle school, and college age. There are 2 studies that came out this week that talk about the risk for children. UCSF looked at the admissions and the risk factors for young adults aged 18 to 29. What they found was that about a third of those people in that age range are actually high risk. The most interesting thing they found was that diabetes, obesity, asthma, and steroid use, all of those things were high risk factors, but the biggest risk factor for this age group was smoking. Now, in some studies, smoking has not been found to make a difference, but for young adults, the vaping, the lung damage, and smoking, a third of the young adults who smoked caught coronavirus in their sample. So that's pretty impressive, and that's also concerning for the college age versus the younger adults. If the people did not smoke, it was down to a 16% of them had risk factors, were considered at risk. So that is a different kind of category. Looking at the younger students, one study that was out of Denmark looked at about 96 people that got coronavirus, and they tracked them all to see where they got it from. Turns out only 8% of them got it from a child, even though every single one of the households had children in it. So it was much more likely for adults to bring coronavirus home to the children than it was for children to spread coronavirus to the adults. That said, 8% is almost 10%, and 1 in 10 is a lot. So here is what I think we need to do to get schools started. First of all, go back about a month. What we need is a very strong central message from the head of the United States that any county that has even one coronavirus case in it needs to shut down for 3 weeks. That's almost everybody now. We just need to shut down for 3 weeks. 3 weeks is enough time for people who are exposed to catch it, to have their symptoms, and the likelihood of spreading coronas on the back end is much less than spreading it before you're symptomatic and when the symptoms first appear. So 3 weeks should be enough time to take care of the people who have just been exposed, get them through it, and past the place where they're going to spread it. All of this has to happen at the same time, though, because if we don't do it at the same time, then we're going to mingle and people are going to move and bring it from one place to another, and that's not going to work. Second thing, so after we do a shutdown, or after we get enough stuff together so that we're ready to do a shutdown, if anyone catches the virus or comes down positive with it, they need to be isolated, and people that are around them need to be quarantined until we know they don't have it. Now, this is actually not as difficult as it seems. Many colleges have an infirmary, or they have a dorm that's not being used, or they have a place where people can be sick together in the same place. So what we need to do is we need to have screening that is done in batches. So periodically, one study found that you'll need to screen about 75% of the students once a month, so you just randomly get batches. But what you can do to save money and time is to have a whole bunch of people either all spit into one jar or have everybody have a nasal swab and all put it together, and then do that as a batch. So if you do that as a batch of 20, if one person's positive, then you can go back and test that whole group of 20. But that way, if everybody's negative, you only need to, then you can go on to the next group. So you don't have to run a test on 20 people. You can put 20 people's spit into one thing and then just run it once. And the way that the tests work is they find a scrap of DNA or RNA and they amplify it so much that even a tiny bit of a scrap, you can see the disease. So batching, sending. So that's one thing. Before we shut people down, we need to have the batching testing process in order. We need to have enough PPE so that the places that we have shut down, when they open up again, they can stay safe. We need to have the houses for quarantine and the systems for isolation in place. And we need to have contact tracers who are hired and ready to go and able to figure out who was exposed to who to be able to trace those cases back. We need to have smell testing so that we're not blinky thinging somebody, but instead when we are screening people, we're screening with smell because that's what matters. And all of this has to be done before it makes any sense to shut everything down. So if I wanted to get people back to school, then about a month ago, about 3 months ago, I would have been making sure that we had the contact tracers, that we had batch testing set up, that we have places for people who are sick, and that we have people who can take groceries and take food to those people who have to be separated or quarantined, either from high risk or from the other reasons. But I will say that until we shut everything down at the same time, I don't know that we're ever going to get rid of coronavirus. I was very hopeful before because other countries have done so, and I was hopeful about a vaccine. But unless the nasal vaccine works, I'm a lot less positive on injectable vaccines working for very long. Unless we do everything at once, possibly even globally, I don't think that we're going to be able to stamp this thing out because it's so hard to find it and catch it. So if your child is going to school this fall, if they are older, by all means, make sure that you talk to them about smoking. If they are older, send them to school with quercetin and vitamin D, especially when it starts getting dark outside, and zinc and vitamin C. Make sure that they wear a mask, and if they don't want to wear a mask, that's fine. Have them wear a little nasal clip and one of those head shield things. You know, we've talked a lot in parent circles about the loss when children are wearing masks and how sad it is when they can't see each other's faces. There's beautiful pictures from Japan of these cute little kids wearing what look like lightweight welding masks, you know, just a face shield. You've got a little foam thing here, comes down, put a Spider-Man on it or a princess from Disney, they'll wear it for hours. So I think that we can see each other's faces and let the kids see each other's faces while still being protected. Most important thing is that if someone gets sick and tests positive, we need to be able to know that day, and everybody in the school needs to have an alternate plan for 3 weeks to shut something down so people can do distant learning for periods of time. None of this is easy, and things are a work in progress. So what we learn now may not be applied for 4 weeks, a month, but we need to be kind about the fact that knowledge changes. Human beings do not change their minds very easily, and particularly in these polarized times, people attribute right or wrong with value in their tribe. If we can all be a little kinder, if we can all realize that the science of the thing is going to change and evolve, and we sometimes are going to have to act on the best likely knowledge rather than 100% sure knowledge, and if our leaders will open up to the flexibility of publishing likely directions, then I think we can all have enough information to make good decisions about ourselves, our children, and our families. Urge legislators to get behind a plan for a countrywide, brief, limited, specific shutdown, but not until it's going to do something that's going to help. And until that time, I hope that it's not just mice who are being prevented from catching coronavirus with the nasal vaccine. I hope that we find that our nasal irrigation study demonstrates conclusively how you can prevent having severe disease if you do catch coronavirus. And until next time, wear your mask. And if not now, if not a year, 2-3 years from now, eventually, seriously, it's going to be fine.